Hello, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus in Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the anatomy of the arteries. So arteries are the blood vessels which carry the oxygenated blood from the heart to the various part or the tissue of the body. So first are the characteristic features of the arteries. So they are thick-walled and uniformly thicker than accompanying veins, and except for the arteries within the cranium and the vertebral canal, where these arteries are the thin. In arteries, the lumen is smaller than the veins, and there are no walls present in the arteries, but walls are present in the veins. Next is, an artery is usually accompanied by veins and nerves, and three of them together form the neurovascular bundle, which is surrounded and supported by fibroareolar sheath. Next are the type of the arteries and structure. So first are the large arteries, which are elastic type. For example, aorta and its main branches like brachiocephalic, common carotid, subclavian and common iliac, and pulmonary arteries. Second is median and small arteries, which is mainly a muscular type. For example, temporal, occipital, radial, popliteal, etc. Next, third is smallest arteries, that is muscular arteries, which is also known as arterioles, and their diameter is about 50 to 100 micron. And these arterioles further divided into terminal arterioles, where diameter is 15 to 20 micron, and having one or two layer of smooth muscles in their walls. And the side branches from terminal arterioles called the meta-arterioles, and their diameter is about 10 to 15 micron at their origin and 5 micron at their termination. And the terminal narrow end of the meta-arteriole is surrounded by three capillary sphincters, which regulate blood flow in the capillary bed. So muscular arterioles are responsible for generating peripheral resistance, therefore regulating diastolic blood pressure. And microscopically, the arterioles are made up of three coats or the three layers. So these three layers are the innermost layer is known as tunica intima, middle layer is known as tunica media, outer layer is known as tunica adventitia, and the outer coat is the strongest of all coats and merged with perivascular sheath. And the relative thickness of the coats and the relative proportion of the muscular, elastic and fibrous tissue vary in different types of the arteries. So this figure represents the microscopic structure of artery, veins and capillaries. So in arteries, there are three layers of the arteries. The outer layer is known as tunica adventitia, middle layer is known as tunica media, and the innermost layer is known as tunica intima. Thank you.